This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Dr. Vanessa Dean, a naturopathic physician who currently works for Tutera Medical SottoPelle. Prior to that, she spent the majority of her medical career focused on general family medicine. She has helped countless patients regain their health through an integrative approach aiming to build strategies for lifelong health by providing hormone replacement therapy utilizing pellet therapy. And Dr. Dean, thanks for joining us here today on eHealth Radio.
Yeah, thank you so much for having me.
And you're more than welcome. Certainly our pleasure to have you out, and thanks for your time. So to kick things off today, I understand you've been in successful practice for a good while now. How long have you been treating hormonal imbalance?
Great. So I've been in practice for about 3 years now, and in the entire time I've been focused on hormones.
In taking that further through your career, what is the most common complaint that you hear from patients in regards to hormonal imbalance?
So when patients come to me in the office, they most commonly complain of a handful of things, and this is both men and women. I would say the biggest things I hear about are low libido, weight gain, fatigue, and brain fog, and those, go for both men and women. Women come in with, some more severe symptoms such as night sweats, insomnia, anxiety, depression. The list really goes on, so there's quite a variety of symptoms that, can occur when you have low hormones.
Interesting information there, and thanks for that. Tell us, what's a common myth about hormone therapy, and can you actually debunk that?
Sure. So I would say there's two big common myths that I see walk in the door and people have questions about. One of them is, do hormones cause cancer? And, this was a big topic of discussion back when a study came out in 2005. It was called the Nurses Study. And it was essentially trying to determine if hormone therapy caused cancer, specifically estrogen. At the time, the research came out saying, yes, indeed, estrogen does cause cancer. Now, years later, that research has been revisited. In 2011, they revisited all of the research and found it to be quite flawed. So now we know more, and we know that estrogen does not cause cancer. If it did, every young woman of childbearing age, who has high levels of estrogen, would be having breast cancer, and that's just not the case. So what we found now is that estrogen indeed can, cause certain types of cancers to grow faster that happen to be estrogen receptor positive. However, across the board, it does not cause cancer. And a second, a misconception that I hear a lot from women is, I didn't know I needed testosterone. I thought women only needed estrogen, and that's just not true. There's, a large variety of functions within the body where the women truly need testosterone just like men do, including muscle mass, libido, stamina, brain function, the list goes on. So I would say that's a big misconception that walks through the door.
Today we're speaking with Dr. Vanessa Dean, a naturopathic physician who currently works for Tutera Medical SottoPelle here on eHealth Radio's Health News Channel, a part of the eHealth Radio Network. Now, Dr. Dean, what do you think is the most important thing our listeners need to know about their health and hormones?
Gosh, there's so much to know about hormones, and that's why it's important to speak with a professional. But a lot of people understand losing your hormones as you age is just a natural part of aging. However, it's not something that we should necessarily be living with. There are tons of other organs in the body, and when those fail, we treat them. So low thyroid function immediately is treated. What's odd to me is that the ovaries and the testes stop working, and we have low function, and as a society, we don't tend to treat that or see that as a problem. But it actually is quite a big problem. If you don't have your estrogen and testosterone as you age, it affects some things that you can't even see: your bone health, your brain health, your heart health. So I really want people to realize that their hormones are more than just, feeling and looking good. It's also, there are things deeper that we can't see that are important.
Yeah, and very important that you pointed that out as well. Now, if a patient is suffering from menopause or andropause, what is the first suggestions that you make to them?
Sure. So the very first suggestion I always make to anyone is have their blood work done. You know, a lot of physicians will say, again, this is a natural part of aging. However, people can go into premature ovarian and testicular hypofunction, which means low function, at a very early age. So the proof is in the pudding in terms of the blood work. We can really pinpoint what's going on and see how severe the deficiency may be. So to anyone that sees me on the street or chats with me, you know, at any point in the office, the first thing we do is blood work.
And that certainly does make sense. Good stuff there. Now, do you think hormonal imbalance is easier or harder to diagnose for men or for women?
That's a good question. I find that to be, you know, I have a compounded answer for that. I would say it's equally as easy to diagnose in both men and women because we focus on the blood work. And like I said, the proof is really in the pudding there with the numbers. However, you know, menopause is a little bit easier to recognize just because the symptoms are more severe. Women have anxiety, depression, hot flashes, they can't sleep. You know, the severity of symptoms is pretty severe. They also have a menses that we can track. We can track a menstrual cycle to determine what's happening. Whereas men, the symptoms are a little bit more gentle. They may slowly lose libido, muscle mass, stamina, and focus as they age, but we can't really track a menstrual cycle in a man to determine where they are in their aging process. So I would say diagnosis is a little bit easier for women. However, blood work can really help us determine what's going on for both men and women.
Yeah, it certainly sounds like blood work is the key here in all regards. And again, we thank you for what you do through Tutera Medical SottoPelle and for joining us here today. In conclusion, any closing thoughts, a takeaway, a tip, anything else you'd like to share along the lines of our conversation today?
Sure, of course. I just encourage anyone who think they may be suffering from hormone concerns, including younger women who are not quite into menopause yet. There are times when we can help you as well. So I encourage anyone who think they might have a hormonal problem to come see us, and we'll figure out what's going on.
And of course, we certainly appreciate that invitation. And if listeners wanted to get further information on Tutera Medical or SottoPelle online, where's the best place that they could gather those details?
Sure. So our website is tuteramedical.com. We have 4 offices in the Valley here in the Scottsdale area, and you can reach us at 480-874-1515.
And that certainly works. Again, Dr. Dean, all the best, and thanks so much for joining us here today on eHealth Radio.
Great. Thank you so much for having me.
And of course, it was certainly our pleasure. We've been speaking with Dr. Vanessa Dean, a naturopathic physician who currently works for Tutera Medical SottoPelle. Dr. Dean has helped countless patients regain their health through an integrative approach aiming to build strategies for lifelong health by providing hormone replacement therapy utilizing pellet therapy. And for further details, visit tuteramedical.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.